When a conversation comes up about scars and people want to show off their battle wounds, more often than not, I have the biggest scars. If you were to line them up, I have about 24 inches of scars along my Achilles tendon and the inside of my foot. It's just too bad I don't have some incredible story to go along with them. I didn't survive some dramatic skateboard crash or bike crash or car crash or anything like that. I wasn't attacked by any exotic animals or anything like that either. I was born with congenital talipes equinovarus, or more commonly known as clubfoot. Its nickname clubfoot comes from the angle of the foot to the ankle, making the child's foot look like a golf club. When I was 18 months old, I had to have corrective surgery on my Achilles tendon in an effort to straighten out my foot correctly, and I've had the scars my entire life. I've outlined them with a pen in case they're hard to see on camera. And I also have that on both feet. Today I would like to inform you all a little more about clubfoot, its symptoms, effects, and treatments, along with my personal experiences. Let's start with background information on what clubfoot is. According to Dr. Michael Vitale, an orthopedic surgeon, and his article describing clubfoot and current treatments, clubfoot is the most common musculoskeletal birth defect and 7th most common birth defect overall. It occurs in about 1 in 1,000 births, and doctors often say they see it at least once or twice a week. Males are also twice as likely as females to have it in a ratio of 2 to 1. And about half the cases of clubfoot are bilateral, meaning both feet are affected, like my case. Clubfoot can be associated with other skeletal abnormalities, such as spina bifida or other congenital defects, such in the upper limbs. Hands can have the same defects and sharp angles for the wrist to hand as feet to ankles. Having clubfoot means the infant's foot is twisted out of shape or position. It's because the tendons are shorter than usual and causes the foot to be twisted at a sharp angle at the ankle. According to MayoClinic.com, symptoms would be the top of the foot is twisted down and inward, increasing longitudinal arc curve like this. The heel is turned down and the foot is in plantar flexion. The foot is almost perpendicular to the shin. Also, the feet and calf muscles are smaller on the affected limb or limbs. After extensive research devoted to clubfoot, there's still no scientific origin or cause known. However, it is agreed upon that there is some type of hereditary aspect to clubfoot, as in my case, many people in my family and extended family have been born with it. The British Medical Journal describes a case when a woman was taking Devonox 5 weeks into pregnancy, which is the time of upper limb formation, and the results were her child were born with congenital abnormalities to the infant's hand. This does not prove that drugs can be the cause of it, but it points out possibilities and strengthens suspicions about using drugs of this sort during pregnancy. And also there are similar suspicions about maternal drinking and cigarette smoking. Trying to walk with clubfoot can cause a lot of pain and discomfort, so it's important and recommended to treat the deformity soon after birth. And now let's look into some methods of treatment. Well, first off, clubfoot can be detected while the baby is still in the uterus through ultrasound, and it's often by the 2nd semester, so the parents will know, or often know, if their child will have clubfoot when born or not. Parents initially become worried or concerned about their child's immobility, whether the child will be able to run or walk correctly, or be a subject of strangers' stares or denied opportunities for relationships. Most children with clubfoot are otherwise healthy babies, and in most cases, the infants are treated early and grow up to live normal and active lives. A About 10% of children with clubfoot develop a reoccurrence by the age of 3. This just means that after treatments that their feet start to regain the clubfoot look, it turns back in. And this happens because one of the tendons on the inside of the foot is larger than the other and is overly active. This is easily treatable, but important to notice and have taken care of. According to the Turner Scientific and Research Institute for Children's Orthopedics, ultrasonography is also useful for monitoring clubfoot correction and for early diagnosis of spurious correction and deformity recurrence. Recent studies indicate 95% of children treated with the Ponseti method have excellent results, and a large majority are functioning normally 35 years later. The Ponseti method, developed by Ignacio Ponseti of Iowa University, has become today's standard for treating clubfoot. The Ponseti method includes specific manipulations using what's called a boots and bar, which I did not use, but it's to set, kind of like cast, but to set the baby's feet in with a bar in between to keep them set at the correct angles. It also includes casting, which I did do, and I have some examples here, a few that my mom has kept over the years. One early one with the feet pretty crooked, but then the casts are periodically removed and reapplied and readjusted as progress and the child's feet improve. And here's a straighter one. But in severe cases that don't respond to non-surgical methods, surgery can be done to lengthen the tendons and release pressure from the feet and ease more into a normal position. In the Journal of the American Medical Association, there's a section titled "Clubfoot and Newborn Infants" when describing the debate over which method is best, plaster or cohesive bandage. And the author states, "It's been well established for many years that plaster or Paris cast could be applied as early as the first day with perfect safety, and that correction could and should be promptly started." As seen in my case as well, I don't remember dealing with this much at all, except a few trips to the doctor, having my feet twisted to straighten out, and wearing a couple little inserts in my shoes. But otherwise, I've been playing sports my entire life and never really had many problems. Running a little with my toes pointed in, but supposedly that's supposed to help me run faster anyway. But as long as clubfoot is treated early and correctly, it's not a very serious birth defect, and most children will learn to walk and run just fine and continue on with normal lives.